Hello viewer, welcome to today's episode of Health Talk Show. Today we are going to discuss about physiotherapy. My name is Lucy Wansakariuki, and with us today is a special guest, and I kindly invite him to introduce himself. Welcome to the show.
Thank you very much. Hello viewers, my name is James Wanzala, a physiotherapist at Tibabu Health Consultancy. I've been practicing for 5 years now and counting, and I'm happy to have joined this profession. It's a wonderful profession, and at Tibabu we do miracles. We have seen what physiotherapy can do, and we are hoping to achieve more even as we continue on. Thank you very much.
Thank you so much, James. And what is this we call physiotherapy? You've told us you are in a certain clinic. Where is it located also?
Our clinic is at Ngara, Moranga Road, at Dereshe Towers, Suite 4.5. That's where you'll find us. You want to know more about physiotherapy?
Yes.
Yes. Physiotherapy is a rehabilitative science that majorly deals with restoring function, especially after injury or an episode just in your life, or majorly it's an exercise therapy that deals in restoring function after an injury, majorly.
Now that is where the question comes in to many people.
Yes.
Physiotherapy and exercise.
Yes.
Is there a difference? And can a normal person who has not undergone any event in life attend or visit a physiotherapist?
I want to say that physiotherapy is a day-to-day, is part of our living, is part of our life. That is how you should look at it. That's why I said post-injury or just a healthy person, just like myself. We also do exercise prescription. Mm-hmm. That is majorly for people that are not saying that I'm unwell, but you want to start going to the gym, you want to work out, you want to start jogging. That is where now you would advise you, if you can assess a physiotherapist, that would be better, because then we will tell you, we'll look at your body weight, your height, what we call BMI, your lifestyle, what do you do at work. Then that way now we will be able to prescribe an exercise for you, a regimen that you will follow. You see, in that case, you are not sick. You are fine, you're well, but you want to improve on your physical health. Yes.
So when you want to improve on your physical health, that is physiotherapy.
Yes.
Sometimes you find just normal people, not sick, no injury, nothing, stretching themselves, throwing legs up and down. Is that part of physiotherapy or exercise?
Yes. Exercise and physiotherapy cannot be divided.
Yes.
I want to put it like that.
Cannot be separated.
They cannot be separated.
Yes.
Because once you go to exercise, you want to know, how do I stretch, for instance, my thigh muscles?
Yes.
The quads and the hamstrings. Yes. How do I stretch them? And to what limit am I supposed to stretch them? You see, now that is now where a physiotherapy comes in. Let me bring it much closer to people who watch sports.
Yes.
Majorly when you're watching a sporting event, especially football, and you see a player in the field is probably injured and they're not taken off pitch. They're just attended to immediately, and they get up and they continue playing. That person who attends to them, 99% is always a physiotherapist.
Okay.
Yes, in that event, that player is not sick.
So that is a field where we find many physiotherapists in the sport.
In the sport.
Okay, good. Yes. So when we talk of physiotherapists, is it a career? Is it a profession? Where do you get your knowledge? Or you can just train anybody else and become a physiotherapist?
As with everything that we have come to learn, that have been documented, first it was a passion to some people. Then it was documented into books.
Yes.
Then now it was passed down as a training that people should undergo. Because then again, as rules form, you find that now we must have guidelines, health guidelines. And that's why in our republic today, we have courses. They begin at diploma. We don't have a certificate course. Okay. You begin at diploma. You can go to degree. Currently, it's available. Master. You can do your PhD and everything. Yes. So For starters, you have to train to become a certified physiotherapist. And even after training now, you must be licensed. Just like any other profession, you find the most pronounced one is nursing, where you have nursing council. Yes, now we also have Physiotherapy Council of Kenya. Yes, that is where now every graduate must be licensed by the licensing body, that is PCK, for you to practice here. Yes, so
can you be trained by institutions that are not hospital based?
I haven't heard of any currently in our country. The only one I know are I know of KMTC. AMREF started recently, and we have JQuat, Moi is training. Those are schools that you must, there is a curriculum that you must follow. You can't walk into an hospital and be trained. Of course, I know nurses observe us a lot, especially in the hospital when we are working, but you will only see us moving the patient's limbs, getting them up to walk, ambulation and everything, but that will not qualify you to be a physiotherapist. Yes, you must go to school. And even myself today, in our clinic, when should we be employing and say, we sit down and now we need extra, we'll look for qualified physiotherapists. And above and beyond all, we want to see your license. And the licensing body will not license you until they see a certificate. Yes.
So just like any other curriculum, you have to be assessed on your skills, on knowledge and such.
Yes.
Yes. Thank you so much for that information. So if I may ask, you can see I am trying to understand the difference between exercise and physiotherapy. So kindly can you tell us the types of physiotherapy that we have so that we can also compare if exercise could be one of them?
Okay.
Yes.
Types of physiotherapy depend majorly on the underlying injury that or prevailing condition that whoever you are supposed to attend to is presenting with. For instance, if you have back pain and I have stroke, see, those are different conditions. Different conditions that will need different approaches. Then you have someone in the field who's injured. That person also will need a different approach. You look at a child, that needs a different approach. You look at an elderly person, they all have different approaches. And that is where now they came and they derived the types of physiotherapists that we now see. That I'm sure in mastering now, that is where now you can go and master in types. But as a general practice, we have orthopedics, we have neurology cases, we have geriatrics, that is for the elderly, we have pediatrics, we also have sports physiotherapy that you see around, and we also have cases of respiratory cases for physiotherapy, like with the prevailing corona cases. I know physiotherapists are on the front line with corona, but majorly we are doing chest physiotherapy. Yes.
Now that you have listed them, somebody watching you is asking, what is this you're calling geriatric? What is this you're calling this and that? Kindly can you briefly describe each of those which you've mentioned?
Okay.
So that maybe someone could be seeking for help, can know now that I have this is the kind of physiotherapy that I need.
Okay.
Yes.
Now, in nutshell, for each and every type, we'll start with childhood. We have pediatrics. This is where pediatrics majorly deals with children. We either have congenital cases or acquired. Congenital would be like a club foot. A child is born with a club foot. Physiotherapy has to attend to that, to correct that. And that
club foot are those legs which bowed or?
You will see them under the foot. Yes, they are a physiotherapy immediately after birth. A physiotherapist is supposed to assess the child and look for any congenital deformities that the child might have been born with. At that point, that is where now that practice we called pediatric physiotherapy. Now you have to see whether this child is presenting to correct them. As the child is growing, we also have developmental milestones. And you see the first one we always observe is the neck control. When you carry a child, when the child cannot support, you have to seek help from a physiotherapist. Then you also have the reflexes, the neonatal reflexes, that the child is born, the rooting reflex, that those are supposed to be performed. And in case you observe any abnormality in your child as they grow, that is now where we call the developmental milestones.
Yes.
In case you observe any problem, your child is not developing in those categories, then now you have the help of a professional. Probably you'll take them to your doctor, who will in turn refer them to a physiotherapist.
Yes.
From there you go, I want to talk about geriatrics.
Yes.
Geriatrics, now this is we majorly in school, those who in school are calling it gerontology as a subject. That is majorly dealing with the elderly. Cases that the elderly people present with. You see, as you grow old, your systems start reducing how they function. Like you see your muscles, they now become flaccid.
Yes.
You see they're wobbly. Your heart, your respiratory system is not optimal. You see your cardiovascular systems are going down. Now you need a physiotherapist to come and now help you in increasing now the quality of health of an elderly person. If you go to the home for the elderly, you'll find a lot of physiotherapists there, majorly taking them through exercises that they can handle. One thing I want to tell you is the way I will prescribe exercise for you and to an elderly person is different.
It's different.
That is why now you need to specifically study it as a unit so that you can know how to attend to them. Because I know how much they can handle as far as their hearts are concerned.
Okay.
Yes.
Yeah.
Then the next one is, now we go to the neurology. Yes. This is now where you have cases of nerves. Like the most prevalent one that people can relate with currently is stroke. Stroke rehabilitation. And I know everyone is...
Stroke is paralysis on one side.
Yes. Now the doctor will say paralysis, stroke will say paralysis now as my assessment for physiotherapy.
Yes.
I will say you are hemiplegic, paraplegic, and that is now what will inform my approach. Now this, I'm dealing with a neurological case. You have such cases now, cerebral palsy, those are neurological cases that now has to be classified on their own, and also you have to study them as a unit so that you can easily attend to such cases.
Yes.
Then we have orthopedics now. That is where you get cases like knee pain, back pain. Those one now are classified under that category, and they also have their informed ways of management. Yes.
Oh, I'm thinking of the sports.
Yes.
What can attract you to the sports people?
Yes.
If there is no injury?
One thing with physiotherapy also, we do injury prevention.
Okay. And
injury prevention is majorly like, look at how I'm seated. I can also sit like this, or that is called body mechanics.
Yes.
And body mechanics are not only seen when you're seated. When you are doing your sporting activities, we want to know, are you doing it in the safest way possible? If you see golfers, the way they swing, when they are playing, the way they swing, you want to know, are they having their back in the right way? So the only person who can easily and adequately understand that is a physiotherapist. That is why now most teams will want, if even the teams that cannot afford the best medics out there, at least they want to have at least one physiotherapist.
Yes.
Yes. That will ensure that, because most of the injuries that happen during play can be easily handled by a physiotherapist. If not, then a first aider can help.
Yes.
Yes, in cases of bleeding and I want to say that even in that area where I trained, we were trained on first aid.
Yes.
Yes. So myself as a team doctor, I can do first aid and exhaust each and every injury that the player might present with. And also during training, when I'm present, I can note that, hey, this player is not using the right body mechanism. So I have to step in and tell them what is the right way of doing it. Yes.
Okay, thank you so much for that. Yesterday I met a computer student.
Yes.
And she told me one of the questions that was in the exam was, what is the role of a physiotherapist when you're using computers?
Oh.
And I was like, I wish I was one, but I am not.
Yes.
Kindly, can you answer to that student? I will make sure that I tell her to watch you.
Okay. First, especially every profession has its prevalent cases that are majorly underlined by your body mechanics. Biomechanics, we call them. The way I'm seated, for example, if for a computer student, mostly they are seated and working on their computer. I also happen to have had such case last week, but one I had my nephew who was working from home. He also came to me, hey, I'm having problems because he was going to work and now they're working from home. And I told him, your major problem is, he came to me with tingling fingers. And he was saying, when I'm working for long, my fingers are getting numb. And I asked him, where at the office, were you having the same problem? He said, no, they started when I started working at home. Then I told him, you need to work on your sitting posture, the desk you're using, because I realized he was sitting and he was pressing just right after the elbow with the top of the desk that he was using, because he could not reach when he was kind of like this. So he was having that because he was pressing on a nerve. Yes.
Wow.
While at the office, the desk is an optimal place so he can just sit and work easily. So you see, for that case, it's not a case of I have to handle it. It's just a case of education. Advice.
Yes.
And he went like that. The following day, it was gone. And he's not come back because we're in the same house. He's not had such case. For computer students, mostly I will advise you to have a seat where you can sit, your knees are at 90 degrees. Your waist is at 90 degrees. And your lumbar must be supported. You must have a seat that supports your lumbar region. You hear when people they're sold along the highway, those people with those black curved things. They're called lumbar support. They're very important. I had to put one in my car. And since then, even my driving position has to change because that thing is constantly pressing your back, reminding you, hey, sit upright. There's a way your back is supposed to be aligned. Yes. When you do, you'll have it's possible to have a session on back care. And that is where a lot of cases start. Back. For computer student who sits a lot, you'll find their chair is not meant for sitting for long periods of time. You have seats that are just there for like 2 minutes and you're up. Now, if you're using such a seat, especially the plastic seats, they're not meant for sitting and working on them for long. Like the way I'm sitting now, this seat can easily support my lumbar region. So you must be upright always. The table must be at the right place. Then now when you're looking at your computer, you should not be looking up, down. It should be perpendicular to your eye. The screen that you are constantly looking at. That way you also avoid many cases of neck issues.
This is very strange because many people, I don't think I've seen many people at that position when using computers. Many people
are looking down.
And very few look up.
So
I think this is very important. I need to know. In fact, it is very essential for us to understand the kinds of sitting positions that we can use, because I'm also looking at lifting. You talked of sitting, lifting. How are you supposed to lift? Because sometimes, for example, like you've talked of the hospitals with the nurses. You also, being a physiotherapist, a man of 120 kilograms will come to your clinic. You will be required to turn, to change, to lift. Lifting.
Lifting is also a major issue, especially in the healthcare. Our number one customers are nurses. I happened to have practiced in Nairobi.
You salute nurses.
I salute you, and you also one of our research areas.
Thank you.
Where I trained every Monday, or every morning you will not miss, in the hospital now where I was training, you wouldn't miss 3 to 4 nurses. After their shift, they are coming for back pain treatment.
Oh my goodness.
Then they go home.
Yes.
See, that is a case of poor body mechanics. When you are lifting, how are you supposed to lift? People have a tendency of bending when they're lifting.
Yes.
Your knees straight, then you bend at your waist. You see, and when you bend, you must flex your spine to get to reach whatever you are lifting. And that thing is heavy. Now you have to use your back muscles to lift, which are not meant for that work. When you are supposed to lift something, you need to have it between your legs. When you're standing, spread your legs a bit, you have it between your legs, then you go down squatting.
Seriously, James?
Yes, it has to be between your legs, then you go down, grab it, then come up with it. All the while, your back is supposed to be straight.
Let me ask you. I'm lifting a 20 liters jerrycan because I'm from the village.
Yes.
How will that be possible for you?
The jerrycan has a handle.
Yes.
Yes. Just have it between your legs, then go down with your arm, grab it, then come up. If you go to the gym and you
see now I'm taking it from the river.
No, now when you want to have it on your head, then now you need help. That is where now we say poor body mechanics. Because when you are alone and there's a lot of work, you tend to ignore these things.
Yes.
That is what happens. And mostly you'll find women are culprits of back pain, neck pains, because they have a lot of chores and limited time. So if I start teaching you on what to do, you'll think it is faster to just bend and lift it and go. As opposed to what I'm telling you. But then again, realize that what I'm teaching you to do, if you practice it 3 to 4 times in a day, it becomes a lifestyle.
Yes.
Then now it becomes easier.
I come from an area whereby every day we carry firewood, we carry bananas, banana stems, food for the cows, water.
Yes.
We are the ones going to fetch tomatoes for sale for our parents and all that.
Yes.
And there is a rope that we use.
Yes.
So you tie and you are all alone. You throw from the side with all the energy to the back.
Yes.
Then you shake your body well and move ahead. What is wrong with that?
I have seen that because I grew up in the village.
You grew up in the village?
Yes.
Yes.
And I want to say that I will not, there's a saying we say, pack it right and light. When we get to back care, I want to leave that topic for there so that our viewers must tune in for the back care. That is where a lot of this will be handled, because that is now body mechanics, and you're putting a lot of pressure on your back, on your spine. I see it. You put it on here.
Yes.
Then you're now
very fast.
Yes, I've seen that. Yes. Now that falls under back care. What I'm
asking is, yes, that turning and throwing it back is kind of lifting.
Yes. Now that is what I'm saying. That you will start having problems that you see golfers have when they are swinging.
Their body.
Yes. That twist, if I ask you, have you seen your waist and your back up? Have you seen a joint that is supposed to twist that much? There's none. That now
only forward and backward, no side.
Yes, every joint has its range of motions.
Yes.
Range of motions and directions. So my knee is supposed to go front and back. Now if I'm starting to put pressure on my knee to go sideways, you see now I'm not using the right body mechanics. Yes. So if you are using your back, I see it's done like this, then you throw it to your back. Now the question is your back supposed to do that? Then again, it brings me back to my point of the chores that you have and the limited time. Now people tend to ignore their health. Some people are doing that, they feel pain. It is painful at some point for someone to do that throwing, but they have to do it. That's why when you go to, when we went for our rural attachments, you find so many cases of back pain, and you can manage them even for 2 months, and they will not go away. Why? Because after I have managed your back pain, you go back and do the same thing that caused it.
Yes.
So it's not healing.
Okay. Thank you so much for that. And if I may ask, now with all this knowledge, with all these mistakes that are occurring, with so many misconceptions about even the conditions that occur because of poor management of the body, what is your role as a physiotherapist?
Now, there we have so many. I will start with education,
yes,
which is the most important one. Because not everyone can afford a physiotherapy session. There's nowhere in this country where it is free. Even if you go to which one is your lowest, Machakos, then I don't know whether there's a physiotherapy center beyond Machakos and down.
Maybe Kitui.
Yeah,
that is far.
That is far. And even if you go there, they are charging. And for people who come for those sessions, the much you can do to them is probably manage that case and do a lot of education. Ask them, sit them down during assessment, and we ask, what is your profession? They will tell you, I'm a housewife. So what do you do from morning to evening? I want to know how your daily routine is. I carry firewood the way you have illustrated and everything. Then now we go to the point of, how do you carry this firewood? How do you carry your water? How do you sweep your house? And you'll find most cases, especially, and this I've seen across everyone, especially women after birth.
Yes.
One part of physiotherapy I didn't mention is gynecological, where we do cases of post and pre delivery. There's that part of physiotherapy that has to be done. Yeah, for a woman before birth, there are some exercises that you're supposed to be doing. You're supposed to be up and down, keeping your body, being mobile. Then after delivery, you're also supposed to see a physiotherapist to teach you how to breastfeed, to teach you how to now wash the clothes for your infant. If you don't have a help, you have to clean your house. And mostly, that is now part of education that you're supposed to be doing when you're attending to people in the clinic.
Yes.
You must educate them on the right way of doing things henceforth. Or they will become a clinic day scholar.
Sure.
They will be coming every day. And as a medic, that is not motivating.
Sure.
You start wondering, what am I not doing right?
Very demoralizing.
Yes, then you realize this person is a driver. And now you ask them, how is your car seat? Then you solve that and they will never come back again.
Sure.
Yes, you'll have to call them, hey, how are you doing? They'll tell you, I corrected my car seat and now I'm fine. So even for those people back at home, you have to be taught this is the right way of doing it. How do you carry your water? This is how I carry my water. Then you ask, when you get home, you drop it. They will tell you they feel sharp pain at the back after that work. Now it's your work. Just like we said in sports, you also prevent injuries.
Yes.
Even for these people, you have to teach them how to prevent such injuries. Yes. So the major part is education. After education now, you go to the management bit. Yes. Now, depending on that condition, there are different types of treatment modalities that we use. Yes.
Apart from the hospital, where else can you get your audience to do this health education that you're saying?
This I will talk on behalf of my clinic, Tibabu Health Consultancy. We have done a number of medical camps. And our medical camps, we train on diabetes, we train on hypertension because they are related, and then we train on back care, which majorly goes all the way now to exercise. We do this through invites.
Yes.
We have had churches majorly invite us after their service, after their members have been fed spiritually.
Yes.
Now we say, let us help you physically.
Yes.
Because even your spirit lives in this body. And if this body is not alive and well, then now we are talking about limited activities. That is now where mostly churches invite us. We have done a number here in Nairobi where we come after service. We just teach people, and I want to say that we are not paid.
Yes.
Yes, that is outreach.
Yes.
And Our clinic, sometimes people cannot access it. We have had cases where we went to Kosovo. You've heard of Kosovo?
Yes.
Yes. That place is so far from Gara.
Mm.
And I cannot tell you that we went to Kosovo so that we can get clients to come to our clinic.
Yes.
No.
It was to the community.
Yes, it was a burden that a priest there had through our director. Our director came to us and said, guys, we have been called to go do a community work. And as usual, we are not charging.
Yes.
So we went there in the afternoon, did our presentations, and even did consultation. After all that, we did consultation. We were sitting one-on-one with people, teaching them on how, after that presentation, they come to, hey, I have a back pain. If it's something that you can manage for a session there, we do it, then we teach you. Now, this is what you're supposed to do subsequently.
Yes. Before we go for our break, something disturbs many people. I've heard of massage. I've heard of something called reflexology. What are these? And are there other terms or other things that fall in that class of those terms which maybe you could highlight for the viewer?
Yes. Now, when you talk of massage, we do not call it massage. When you come and
to your clinic,
to my clinic, and people will come to you with the prescription written, massage this. We have different. The massage is we call it soft tissue release or soft tissue manipulation, STM, and that is a way of treatment.
Yes.
And there are others. We have modalities. We have manual therapy. Exercise is part of treatment. So all these have their indications and contraindications.
Yes.
Like now, you can't come to me that you're having burns, then you're telling me massage. Now, where do I massage? Because we also do physiotherapy for people with burns.
Yes.
Now you see, not every place you will do everything. Yes, that is one thing that we're having a problem with our clients. Every person wants a massage.
Yes.
Yes, even when it is not possible.
Applicable.
It's not applicable. Your condition clearly contraindicates massage, but you know this is physiotherapy, and we are called watu massage.
Yes, that is how we know you from the village.
In the village, we are called watu massage.
Yes.
And when they come to a clinic, they expect that. Now we tell them, hey, physiotherapy is so big.
Yes.
And massage by itself is not what you need. You need massage. And 1, 2, 3.
Yes.
Yes. We first have to agree on that.
Okay.
Yes.
Yes, our viewer, we are discussing about physiotherapy. It is very interesting concept that we are learning today. We are with James Wansala, and we are going to continue right after break.
Or dial *719#. COVID-19 is preventable. Protect yourself, your family, and the community. This message has been brought to you by the Government of Kenya and its partners.
Smart this morning for the workout you have just done. I hope you have enjoyed yourself.
This is our world, our country, our community, and our society. It's all happening at Chungu cha Jamii. In this place, we talk about parenting, we talk about marriage, we talk about relationships, we talk about dating. We go to the prisons and find out how life is over there. We talk about the village, what happens down there in our slums. What exactly is happening back in our schools? What is happening with the people that we know as our husbands and our brothers? What is happening with addiction also in our society? We offer solutions. We bring in experts, we bring in psychologists to tell us more on how to handle our problems. Come, let us share together. Let's get round the pot. have some soup and talk about the issues in our community.
This message has been brought to you by the Government of Kenya and its partners.
Welcome back, viewer. We are continuing with our discussion on physiotherapy. Right now, I would like to invite our guest once again, who is James Wansala, a physiotherapist practicing here in Nairobi at Gara. James, back to you. Kindly tell us, how is it like to be a physiotherapist?
Going to do physiotherapy first, I didn't know what it was. I was directed, as I said, and I came to learn that it's a very interesting course. It's one course that we don't use medicine.
Yes.
We don't do surgeries. Yet, someone comes to you with a problem and you make them and they feel better. Most of the patients we have attended to are always surprised. Especially someone can come to you with a knee pain and they are in excruciating pain and all they need is help.
Yes. Then
you go in, do your assessment, and within no time they are feeling better. You tell them stand up, you see first they have fear. Oh, what if there's pain? Then immediately, it's better now.
Yes.
That is fulfilling. It's like magic. I'd say it's like we do magic. Yes. Just that touch and the patient, whoever came in with pain and it is gone. We say pain is not a lifestyle.
Yes.
And once someone comes in with pain, we do what we are supposed to do and they feel better. You feel fulfilled. Especially as a medic, knowing that you are called into that profession to help and especially help patients, and pain is not a good thing. Yes. Everyone who comes to you with pain is in need. And just knowing that you can help them live a normal life thereafter, it's fulfilling. Even when you're going home in the evening, knowing that I helped today make someone's life better. I helped put a smile on someone's face, yes. Not with food or anything, but health. You feel good. It's fulfilling, especially when your patients are healed and they're calling you, hey, asante sana daktari. You feel very good.
What are some of the myths and misconceptions towards physiotherapy?
Yes. Okay, for starters, sisi sio watu wa massage.
Yes.
Yes, we do more than that.
Yes.
We do more than that. And I'd say, come, whatever it is, whatever the case it is that you're feeling, come first, find out from us what it is you are dealing with, then we'll advise there. Secondly, I'd say physiotherapy is not painful.
Yes.
As people would think. It is not. Yeah, someone will tell you, utanifinya sana, or will I feel so much pain? No. We have techniques that we can use to circumvent the pain and still make you feel better.
Yes.
Yes.
I remember one time my mother had a problem of the leg.
Yes.
One leg.
Yes.
Then when I took her to the physiotherapist, myself, I never joined her inside. After she came out, she gave me a very funny story until I laughed. Amenishika tu. Then I asked her, do you feel better? She said yes. She was given a return date of 2 weeks. She came back and the pain disappeared. Then it was after that when she said, now I feel good. I respect what they did. They didn't just touch me, but they did something that I didn't understand. Do you think that is what you do? Things that people don't understand?
Yes, I'd say we're having a challenge, especially in the rural areas, where mostly people still are not exposed to this thing called physical medicine.
Yes.
And I say physical medicine because we have physiotherapists, we have physiotherapists, we have nutritionists, we have dental technologists, we have orthopedics. These are people who are in the rehabilitation medicine.
Yes.
What we call, I'd say physical medicine. People are not exposed to it back at home. They know of a doctor, and they know nurse, and they know that people put plaster on their foot, and we have X-ray guys, the imaging. Majorly, if you walk when you go to a district level hospital, those are the things you will find mostly prevalent. You will not find a rehabilitation department set up. So people are not exposed. That's why you will find someone going to take medicine when they have a knee pain, something that a physiotherapist will deal with in like 2 to 3 sessions, and they are fine. But they will take medication for a lifetime. And you have seen these opportunist medicine people who come and tell you, oh, this medicine can cure all the diseases in your body, including arthritis and such. And we see our grandmothers and mothers at home having problem with arthritis, and they keep taking medicine, and they're taking medicine, and even the drugs they are taking are not research based.
Yes.
Yes.
Okay.
So I think that more exposure should be done, especially at the rural places, so that people can know and appreciate, like your mother did with kushikwa to is, because it can help change someone's life.
Yes.
Yes.
What are some of the clients that you deal with?
Our clients majorly, as I said, mostly will do to prevent injury or after the injury.
Yes.
Some people who have knee problem, you have back problems.
In the preventive
preventive class,
you're talking of people like who?
Preventive class, we have sports people.
Sports people.
We have people in even professional people, like in careers like nursing. We'd want to teach them ergonomics. These are body mechanics that when you are going to make a patient's bed, how do you bend? When you are transferring a patient, those are now injury preventions. We'd want to go to factories where people are doing heavy liftings and teach them how to prevent injuries. We want to work with the women who have given birth to tell them how to prevent upper and lower back pain. And we want to work also with say teachers in schools. For them, we want to get them have the knowledge, then now transfer it to the pupils when during PE, because at home we do not have the luxury, or say most schools, the luxury of a physical education teacher, as some schools do. And this now is a knowledge that the teachers then should have when the children go for PE. Now you tell them, what can you do? Because I remember myself when I was in school, you're just told, go around the field. Some people are fainting, some people are falling, or jump like this, stretching, they're stretching in the wrong way. So if teachers are qualified and they have prior information and knowledge on how to prevent injuries in school, and even first aid, majorly first aid, you'll see they teach you how to react to an injury, not how to prevent it majorly. And preventing physical injuries like joint sprain, joint strain, you want to tell the children when they're coming for their games what kind of shoes are they supposed to be wearing. Yes, so those are some of the people that will approach majorly for injury prevention.
During sports in primary schools, in secondary schools, there are these things we call acrobats.
Yes.
Acrobats, and I remember I was part of it in primary school.
Yes.
And you could do very strange things.
Yes.
And a lot of foldings of the body parts, jumping, rolling your bodies. In that kind of sports, in that level of education, where do you come in?
Now, just as we are talking about, that is now where, as you're growing, let me start from there, you find that you are flexible. You could do things that right now, if I tell you to do, you cannot.
Yes.
And that is part of childhood. You are flexible. Your joints can move beyond the range of an adult. And now that's why I'm saying teachers, if they are exposed to injury prevention, they can now teach these children how to safely do whatever they are doing. And they can easily say, this maneuver you can't do, because we have problems now in our adulthood that are as a result of injuries in childhood. Yes. Yeah. So you are injured during those acrobatic things. Then when you are now a grown up person, now you start wondering, my knee pain just began. I can't remember an incident of injury. Now that is where now you start recalling, oh, when I was a child, I used to do 1, 2, 3. We tell you, see, it is an injury probably sustained and it didn't go.
Okay.
Yes.
So what you're trying to tell us is that in childhood, there are things that we do that will not harm us.
Yes.
But to some extent, some maneuvers are harmful to our health.
Yes.
And many people, the problems that they're facing today could be as a result of things that they did in childhood or some works that they did in childhood. Thank you so much for that. How can people get you? Where can people get physiotherapy assistance? Because if I see the WHO blocks of health workforce is one of them. And physiotherapists are listed as one of essential health workers that the hospitals cannot do without. So if you were to refer people, apart from where you are, I'm sure you will tell us, because there are people in Nairobi who would like to come, or even from beyond. But for the others, where can they get the services of physiotherapy?
Yes. Currently, we are located at Ngara, as I've said, and we have, you can follow us on Facebook, Tibabu Health Consultancy. Also, you can visit our website, www.tibabu.co.ke, and you can also call us through our numbers that are being shown to you. And for the people that are back home, I know currently every county referral hospital must have a physio. There are departments there. And to help you, I want to say that if you have any case of bone, nerve, or muscle pain, go to your doctor and ask to see a physiotherapist.
Yes.
They might not be where you are because probably you're going to a dispensary. They will refer you to the next, at least where they know, because doctors know. So if you have such cases, present to your doctor, and sometimes it's not enough to just take medicine. The doctor might be helping you because he knows you need physiotherapy, yes, but the hospital doesn't have. So sometimes it's good just for you as a client to just ask, I am having these problems, but I know physiotherapy can help me. So would you kindly refer me to the nearest facility? Yes. For the poor in Nairobi, there are so many, like for instance, ourselves, even where we are, you will see so many physiotherapy clinics, but now when you go back home, it's a challenge. And even sometimes in Nairobi, in the slums. So just ask if you have such cases, or movement dysfunctions. Like you see someone limping, you see someone not walking in the right way. If you feel such cases, please ask to see a physiotherapist. Yes. Don't rush to medicine first.
Physiotherapy, is it celebrated in any day of the year, the way we see the nurses' day, the pharmacist, and such things? And if yes, what do you do during that day or that week?
Yes, we have a physiotherapy day, and it's celebrated just like any other profession. And mostly you will see people, that is where now we'll do awareness, telling people what physiotherapy is. And also those are the days that, like if you come to our facility, for instance, now I will not speak for other facilities, we'll do free medical camps, free screenings. Yes, just to create awareness that this is what we are, we exist, and this is what we do. Yes.
Wow. What advice do you have for our clients, for the viewer?
My advice to you is this. Look for us, look for a physiotherapist, and have what we call a pill. Pain-free, instant, long-lasting results. That way, you will start living differently, and as I have said, pain is not a lifestyle. Do not tolerate pain when there is help lacking around. So please today, talk to your medical practitioner, whoever it is, whichever place that you go for your health checks. In that same sense, ask for physiotherapy health checks. This way, you will know your physical fitness, how good your joints are, your body mass index. Please have those checked. And in case you need help, please call a physiotherapist. Or you just research online what physiotherapy is. And you can visit our website, tibabu.co.ke. You will get all the information you need as far as physiotherapy is concerned. Thank you.
Thank you so much, James. It was a pleasure having you in this show, and welcome again and again.
Thank you.
Viewer, this is a talk show whereby we are talking about physiotherapy, which is needed by everybody to prevent problems that may come into our bones, into our joints, into various parts of the body. And we had a special guest in the show, and we have really, really learned a lot. Until we meet next time, I was your host, Lucy Wanza Kariuki.